Hi guys, I wanted to share a little video telling you about what I've learned about COVID or coronavirus. As you know, it is a cell that has crowns on it, and that's why it's called the coronavirus. Now, when we look at coronavirus and how fast it spread, what's concerning is how Italy exponentially increased by doubling every 5 days. At our rate right now, the United States is mirroring Italy, and that is a concern. The one thing that we are also slow on right now is testing. And of course, if testing is slow, then we're really not going to know where the cases are, and it's going to be hard to contain the people who do test positive. We can see that fatality rates in China, the biggest group was of definitely the elderly, and that children were pretty much spared. And that's pretty similar to the rest of the countries right now as well. The other thing that's interesting is that this coronavirus is attacking those with metabolic disease. This one is particularly in China with cardiovascular disease number 1, diabetes 2, hypertension down to 4. And the world rates right now, hypertension is first, then cardiovascular, and then diabetes. So you can see that there is something in folks with metabolic disease that is causing the coronavirus to attack them more. So the other thing is the chronic respiratory disease. If you do smoke, it's a good time to stop because you'll have a higher risk of getting the infection. As far as the symptoms of coronavirus, it's not sniffles. You can see the vast majority of these, 90%, almost 90%, has a fever. The dry cough, the fever, fatigue, those are telltale symptoms that we have to be tested or at least self-quarantine. In fact, that's what the recommendation is, that if you have any of these symptoms, you have to quarantine yourself from your family, from outside, so it does not spread. They say that we should go to the ER only under extreme circumstances. Otherwise, stay home and keep it local. We talk about flattening the curve. I don't know if you've heard of that term, but flattening the curve. And the reason is that in Italy, for instance, you can see that it spiked and it way overwhelmed this line, which is the healthcare system and what it can control. And what we want to do is we want to flatten the curve. So make this curve flatter like this. So hopefully stay underneath the healthcare system limit. So that if, for instance, it becomes severe and someone needs to be on a ventilator, we're going to have ventilators to give them. There were some projections that show that if we are to go the same way that Italy did, the amount of people who need ventilators will outnumber the amount of ventilators we have by 8 times. And that's a serious, serious problem. I've heard of things in Italy, doctors having to choose between 2 people on who can be on the vent and who can't, and who can be treated and who can't, based on age. On one of the hospitals, the cutoff was 65 years old. So if you're over 65 in that hospital, you could not get a vent if you were going up against a younger person. And so that is what we're trying to avoid here in the United States. Flattened curve will also help with supplies such as masks and barrier and gloves and things like that. And we want to stay under the curve. We want to stay under the line of the healthcare system. So as far as closing thoughts, it is a very contagious virus. We've heard things like it can be on cardboard for 24 hours. It can be on doorknobs for a week, longer. Plastic, the same thing. So, for instance, if you're getting stuff from Amazon, probably open your box and then wash your hands before you handle the things like that. Doorknobs should be wiped down. So when you're out there, just be careful. Of course, there's some bad projections that if we don't contain this, that 60 to 80% of the United States will be infected. And if that occurs, then the death rate, even if it's less than Um, even if it's less than 4%, is pretty dramatic. It's not a time to panic. We should come together. We should work together to defeat this disease, this infection. Some things that we're doing in my house, we're taking vitamin K2 and vitamin D3. We're taking 10,000 units of D3. K2 you definitely need if you're more vegetarian. Having a lot of meats does supply K2, but it's okay to take some. We use one called K-Force. It's by Orthomolecular, and if you need some, you can contact me. Fresh air, I think it's good to be outside, try to get as much sunlight as you can. Exercise, meaning walking, nothing tremendous. Wash hands, of course. And we actually have this thing called One with Nature, which is an oregano oil with olive leaf extract. You can get on the website, it's onewithnature.com. And you have to get the oregano oil with olive leaf extract because it doesn't burn. I don't know if those who've been on oregano oil know that it does burn, but this one's pretty mild. Adequate sleep is, of course, very important. Sleeping keeps your immune system primed. Staying away from sugars is very important as well. There is also some evidence to show that even being on a keto diet is very useful in preventing respiratory infections. Not so much with COVID yet as far as studies go, but just in general. And then, of course, social distancing and avoiding large crowds is important. We need to contain this. Anyways, that's a quick little summary of the coronavirus. I hope it helps. Again, it's not to be alarming, but it's to show you the importance of isolation right now. All right, stay well. Take care.